Well, in weather like this may not be the time of year that a lot of people are worried about skin cancer or thinking about sunscreen, but the reality is that you are at risk for dangerous ultraviolet rays year-round. And here with some important advice and perspective on the risks of skin cancer, we're pleased to welcome today Dr. Amit Patel, a facial, plastic, and reconstructive surgeon from UK Healthcare. Thank you for being with us today.
Well, thank you for having me.
You know, we know when we're going to the pool, heading to vacation, people, if you're doing what you're supposed to, are taking along sunscreen. But winter is just as important to think about your exposure as well, right?
Yeah, and you're exactly right. And that's where we frequently get ourselves into trouble. It's not that we get more direct sunlight than, say, Florida or California, but we have a very long spring, fall, and also winter season. And usually when we're out and about, we don't really pay attention to those little windows of sun that come out, and that's where we a lot of times will get in trouble. So a lot of times I tell my patients, just keep a little moisturizer that has an SPF in it, keep lip balm that has the SPF in it, wear a wide brim hat. You just have to be very careful in the winter as well.
Part of the danger, too, I think, is that in winter months we're all bundled up. We're obviously wearing more clothing. You may miss some of the signs of skin cancer. I know you have some photos that you brought. Sometimes they can just be tiny dots on the surface, but really there's much more to the story.
Yeah, you're exactly right again. Skin cancer carries many different faces, and so it's important to do monthly checks. You know, a lot of patients do go to their physician once a year, but I have patients of mine actually keep a body map, write down the size and location, because it's very easy the next month when you happen to be in the shower or look in front of the mirror to say, hey, you know what, I think that was there, but maybe it wasn't. So just keeping track of things is very important. So
now here's an example. Explain to us this patient's case and what you saw with them.
Well, this is a young female who happened to have a lot of sun exposure from just her younger days, and she noticed a small bump on her nose, and it just didn't go away, and so she was smart enough to go in and have it checked out. The unfortunate thing is as you see here, there's a very small excoriation on the top of the skin here, but the area that cancer actually invaded underneath the skin was pretty wide, which you can see here on the right. And so when she finally had that removed, she actually lost the majority of her tip and the side of her nose. And so you can see that these cancers can have deep roots in a lot of cases.
Now, obviously, since you're in reconstructive surgery, you can help restore patients and repair what's taken away. But the goal, of course, is to catch it early enough that it doesn't spread to the point that you're dealing with serious surgery for removal.
Exactly. I mean, these areas on the face, which happens to be particularly prone to catch skin cancer because of the exposure, because we don't bundle up there, it makes my job a lot easier if I'm dealing with a smaller area to reconstruct, and the patients are happier, and that makes my life a lot easier, and it makes me happier too. So.
Well, certainly some great reminders and important advice. Thank you so much for sharing that with us today, Dr. Patel.
Well, thank you for having me.
And, of course, all the folks at UK Healthcare, happy to give you more information through dermatology, through the reconstructive surgery, any of those aspects that you may need to recognize and treat skin cancer. We'll be right back with a check of our winter forecast next.